This video will outline how to manage your feeding tube or rig at home. Sometimes during your cancer treatment, you may have difficulty eating, swallowing, and maintaining your weight. The doctor may suggest you need a feeding tube to help you receive enough nutrients to enable your body to heal during treatment. This tube is normally not permanent, but it is important that you understand how to care for it and use the tube appropriately. The tube may be inserted as a day procedure using a sedative and/or a local anaesthetic. This tube is placed in your stomach and you are able to receive liquid nutrition, supplements or medication, which can be either food or medications to ensure you have enough nutrients each day. This is what the tube looks like on your stomach, and this balloon is inserted into your stomach to keep it in place.
Hi everyone, my name's Francesca Levy. I've had a rig for the last 3 years as a result of treatment for head and neck cancer. The only concern really I had was how would it stay in my tummy. Having the rig has been a really liberating thing for me. It means that I know I'm getting all the nutrition, fibre and fluid that I need in a day, and enables me to do all the things that I need in a day without being tired. One important thing is to be always very, very upright when a feed is running. If you're not completely straight up and down, the feeds can come back up in what's known as reflux, and it can then go down into the lungs. If you're in bed because you're unwell, you can be on a slight incline, but not too much, and always stay in that position for at least half an hour after your feed has finished. It's important to keep the tube that you connect with really clean. Just rinse it out with a syringe after you've used it. You'll also have one of these in your kit, which has a tiny little brush that fits straight down the middle and all the way down to the bottom to give it a bit of an agitation and then another flush. You can also buy these on Tubi websites. It's just material with a clip, and that sits around the site and clips up. It also provides a little buffer and soaks up any leakage so you don't get anything on your clothes. The only other thing that might be a problem is, I don't know the medical term, I call it sucking in. It's a feeling of where your rig is, of it being sucked in really firmly. It happens a little bit after you first have it in. It's because the body knows it's a foreign object and it's trying to absorb it. That's all it is. It can be a little bit painful when it first happens, in a bit of a shock, but it only lasts, I don't know, 15 seconds or something like that. Sort of like a cramp, and then it goes. So don't be alarmed if that happens. It's just the body adjusting to a foreign object. Also, when you first get your rig, you'll have what's called a dangler, which is about that long, that will probably be always attached. You may have that for 3 months, or maybe a bit longer. I used to tuck it up under my bra, or just in the top of my underpants, to keep it firm in place. All in all, I have to say, having my tube is the best thing that ever happened to me. I can't tell you how liberating it is. I've done a lot of choking and aspirating before I had it, and that was quite frightening. So to be able to have food in a way that bypasses your throat is really fantastic. Don't be afraid, it will be your best friend. I just wish you all the best with your journey and with your experience with your rig.
This is often not what you wanted with your treatment, but it is important to care for your tube. In the first week after your tube is inserted, it is important to check the site on a regular basis, make sure it is well secured, clean and dry. When you clean your tube, when you shower, just use soap and water. The main thing is to make sure it is thoroughly dried after you're done. Sometimes food or medications can cause the tube to be blocked. Don't panic if your tube becomes blocked. You must complete a flush with warm water and push the plunger of your syringe back and forth in an attempt to unblock the tube. Gently massage the tubing to help break down any debris collecting in the tube. Do not insert anything other than a syringe to unblock your rig. If your tube remains blocked, contact the CNC for advice. If your tube falls out or is partially attached, tape the remaining tube to your skin and contact your CNC for advice. If it is after hours, go to the emergency department. Sometimes things go wrong and you can get an infection. What to look out for is any redness, swelling, heat, increasing pain, or discharge from the insertion site. If you notice any of these symptoms, contact your CNC immediately, or if it is after hours, go to the emergency department.